A 76-year-old woman walked into a surgeon's office with mild knee pain. She walked out with a surgery date she never asked for. 3 months later, she needed a walker just to get to her kitchen. That is not a rare story, and it did not have to happen. After 70, your body is still strong. But it heals differently. It responds to anesthesia differently, and it recovers on its own timeline. Not every surgery that sounds routine at 50 is still routine at 75. Some procedures carry risks that no one explains clearly enough. Not because doctors are careless, but because the conversation moves too fast. And sometimes the quieter option, the one without a scalpel, is actually the smarter one. Today we are going to walk through 6 surgeries that deserve a long pause before you say yes. This is not about refusing medical care. This is about understanding what you are agreeing to. Let us begin. Number 1. Elective spinal fusion for chronic back pain. Back pain after 70 is incredibly common. Discs wear down, joints stiffen. That is not disease. That is a spine that has carried you through decades of life. The problem starts when a scan shows degeneration, and suddenly spinal fusion is on the table. Here is something many people do not realize. What looks alarming on an MRI often does not match how you actually feel. Studies published in the New England Journal of Medicine have shown that many people with severely degenerated discs on imaging walk around with little or no pain at all. Spinal fusion is not a small procedure. It involves general anesthesia, significant blood loss risk, metal hardware, and months of recovery. For seniors, bone density is often lower. Healing takes longer, and the spine above and below the fused area can break down faster afterward. Doctors call this adjacent segment disease. A 2022 study in the journal Spine found that nearly 30% of patients over 70 experience complications after elective spinal fusion. That is not a small number. So what is the alternative? Targeted physical therapy, core strengthening done gently, anti-inflammatory nutrition, weight management. These are not glamorous, but for many seniors with manageable pain, they work, and they do not require a single night in a hospital bed. If your pain lets you walk to the mailbox, cook a meal, and sleep through most of the night, ask your surgeon one question. What happens if we wait and try conservative care first? That question alone could change everything. Number 2, carotid artery surgery for mild blockage. This one catches people off guard. A routine ultrasound finds narrowing in the artery that feeds your brain. The word stroke enters the conversation, and suddenly surgery feels urgent. But here is where things quietly go wrong. If you have not had a stroke, if you have not had warning signs like sudden weakness, slurred speech, or vision changes, then your blockage may be what doctors call asymptomatic. And for asymptomatic seniors, the research tells a very different story. A major clinical trial called CREST-2, along with data from the American Heart Association, has shown that modern medications, blood pressure control, cholesterol-lowering drugs, blood thinners when appropriate, can reduce stroke risk in asymptomatic patients to levels comparable with surgery, without the surgical risks. And those risks are real. Carotid surgery itself carries a small but measurable chance of causing the very stroke it is trying to prevent. After 70, that risk increases. Add in anesthesia complications, bleeding, and recovery time, and the math changes. Have you ever had a test result that scared you into a quick decision? Most of us have. That fear is natural. But fear should inform your questions. It should not replace them. If you have been told you need carotid surgery and you have had no symptoms, ask for a second opinion. Ask what your annual stroke risk actually is with medication alone. The answer might surprise you. If you are still watching and this is making sense, type 2 in the comments. Just the number, that is all. Number 3, total knee replacement for mild to moderate arthritis. Margaret is 79. She lives alone in a small house with a garden she loves. Her right knee aches when she climbs stairs. Some mornings it is stiff for about 20 minutes, but she still walks to the grocery store 3 blocks away. She still kneels in her garden with a cushion under her knee. She still sleeps well most nights. Her doctor showed her an x-ray. The joint space was narrowed. He recommended total knee replacement before it got worse. But here is what Margaret was not told. A 2020 study in the BMJ found that up to 1 in 3 patients who received knee replacements for mild to moderate arthritis reported no meaningful improvement in pain or function afterward. 1 in 3. Knee replacement is a serious operation. It requires cutting through muscle and bone. It demands months of aggressive rehabilitation, daily exercises, repeated clinic visits, and significant pain during recovery. For a fit 60-year-old, that is manageable. For a 79-year-old living alone, it can quietly unravel independence. There is also a risk most people never hear about: post-operative delirium. After major surgery with general anesthesia, seniors can experience confusion, memory disturbance, and disorientation that sometimes lingers for weeks. In some cases, cognition does not fully return to baseline. Margaret chose differently. She started working with a physical therapist twice a week. She strengthened the muscles around her knee. She lost 8 pounds over 6 months. Her pain decreased enough that surgery became unnecessary. Muscles are your knee's natural shock absorbers. After 70, building them is not optional. It is protective. If your knee still lets you live your life, even imperfectly, strengthening may deserve the first chance. Surgery will always remain an option if things truly worsen. Number 4. Coronary stent placement for stable heart disease. When someone says the word heart, everything feels urgent. A narrowed artery sounds dangerous. A stent sounds like a quick fix. But for stable heart disease, meaning no active heart attack, no worsening chest pain at rest, the picture is more nuanced than most people realize. A landmark trial called Ischemia, published in 2020 and involving over 5,000 patients, found that for people with stable coronary artery disease, stenting did not reduce the risk of heart attack or death compared to medication and lifestyle changes alone. Read that again quietly. For stable disease, the outcomes were similar, with or without the stent. Stent placement is not risk-free. It involves threading a catheter through your arteries. Contrast dye can strain aging kidneys. Bleeding complications occur. And afterward, you are placed on blood-thinning medications that carry their own risks, especially for seniors prone to falls. This is not about avoiding heart care. It is about matching the treatment to the actual threat. If your heart disease is stable, your cardiologist may be able to protect you just as effectively with the right combination of medications, supervised exercise, and consistent monitoring. Ask whether your condition is stable or unstable. That single word changes everything. If this part resonates with you, type 4 in the comments. Just the number. Number 5. Prostate surgery for mild urinary symptoms. Waking up twice a night to use the bathroom is frustrating, but it is also extraordinarily common after 70. The prostate naturally enlarges with age. It is not cancer. It is biology. Most seniors are surprised when they learn this. Mild urinary symptoms, some urgency, a weaker stream, a couple of nighttime trips, often do not require surgery at all. Prostate procedures carry risks that are frequently underexplained. Urinary incontinence that can last months, retrograde ejaculation, post-anesthesia confusion. For mild symptoms, these trade-offs may quietly cost more than they give. Simple adjustments, reducing evening fluids, limiting caffeine after noon, timed voiding habits, can meaningfully reduce symptoms. Medications like alpha blockers can relax the prostate without a single incision. Surgery makes sense when there is complete urinary retention, recurrent infections, or kidney damage from obstruction. But for inconvenience rather than danger, conservative care deserves a full and honest trial first. Has anyone ever explained all your options slowly and clearly? If not, you deserve that conversation. Number 6. Aggressive surgery for slow-growing tumors. The word cancer stops everything. It floods the room with fear, and fear demands action. But after 70, not every cancer requires aggressive surgery. Certain tumors, some prostate cancers, small kidney masses, low-grade thyroid nodules, indolent lung nodules, grow so slowly that a person is far more likely to pass from something else entirely before the tumor ever becomes a threat. Active surveillance is not ignoring cancer. It is monitoring it with structured imaging, blood work, and specialist follow-up. Major medical organizations, including the American Urological Association, recommend it as a frontline strategy for low-risk prostate cancer in older men. Aggressive surgery in seniors carries real consequences. Prolonged anesthesia increases delirium risk. Extended hospital stays raise infection exposure. Recovery can take months and steal independence that may never fully return. Quality of life after 70 is not a luxury. It is the whole point. If you are facing a cancer diagnosis, ask one essential question. Is this tumor low risk or high risk? That answer determines whether urgency is real or assumed. You have lived more than 7 decades. You have earned the right to ask questions, to pause, to say, "Let me think about this." No responsible doctor will rush you for asking. Surgery can be life-saving, but it can also be life-changing in ways no one warned you about. The wisest patients are not the ones who say yes fastest. They are the ones who understand what they are saying yes to. Which of these 6 surprised you the most? Was there one that made you think about a conversation you have already had with a doctor? Share that thought in the comments. Your experience might help someone else watching right now. And if this video gave you even one moment of clarity, consider subscribing. We make these videos for you, calmly, clearly, always with your well-being in mind. Thank you for your time today. It means more than you know.